The National Institute on Drug Abuse defines drug addiction as a chronic, relapsing disorder characterized by compulsive drug seeking, continued use despite harmful consequences, and long-lasting changes in the brain. It is considered both a complex brain disorder and a mental illness. According to the National Survey on Drug Use and Mental Health, an estimated 20.7 million people aged 12 and older needed treatment for a substance use disorder, and 8.5 million Americans aged 18 and older suffered a co-occurring mental health and substance use disorder in 2017.
So one of our biggest challenges in the field right now is preparing our workforce to really truly welcome this population with open arms and with the skill that it requires. So one of the things that I'm passionate about is providing that training for fellow LCASs and administrations who are really trying to provide the latest evidence-based practices in terms of this illness. And with severe opioid use disorders, medication-assisted treatment has long been considered the golden standard for treatment. So we need to see our clinicians become adept at working with folks with trauma, whether that's trauma-informed CBT or seeking safety or other modalities of trauma-informed treatment, but really making sure that our folks are working well on interdisciplinary teams, working with doctors, other healthcare professionals to make sure that everyone has access to recovery.
Addiction counselors credentialed by the North Carolina Substance Abuse Professional Practice Board are specially trained to treat individuals who struggle with substance misuse and addiction. Addiction programs, such as Criteria C, at 11 universities around the state, educate and train graduate students to provide direct services to those seeking addiction treatment.
I oftentimes get asked, why is dual licensure important and why the Criteria C program? And I've learned over time to really think of it from four different perspectives, four different stakeholders. First, we have the client. What do clients want? They want to be treated and seen as a whole person. They don't want to be siloed, go into one door for depressive symptoms, let's say, and sent down the block for problematic drinking. They want a holistic approach, an integrated approach. And then we have the next level, the next perspective, which is the agency level. What do agencies want? Well, with the downward pressure on resources and the ever-increasing expectations and demands on productivity, they need Swiss Army knives. They need clinicians and leadership that are flexible and adaptable and can work with a wide range of populations and a wide range of issues as well. The third perspective I think about is that of the community at large. Communities are looking for a response team, a group of people that come in and respond to the 42 million adults suffering with mental health illness, the 20 million adults with substance use disorders. 7.7 of those have co-occurring disorders. They're looking for help in that regard, and they need people with the skills and ability and leadership to step into those communities and offer a hand. And the fourth perspective is that of the students. And as a professor, I leaned into this and listened very closely. And this is what the students tell me. What they want is job satisfaction, and they want it on two fronts. They want the satisfaction of knowing that they have the knowledge, the skills, and the attitude to help their clients reach their goals. They also want job satisfaction in terms of a career. They want to know that their education and their experience open doors for them. And once they get in those doors, know that what their experience and their education, their dual licensure, will continue to open doors and create upward mobility. A graduating student from our Criteria C program recently said to a group of incoming students something to the effect of, I can't figure out a single good reason why every student wouldn't line up and enroll in a Criteria C program. This program works, and it helps the workforce develop.
I always encourage people to not just do the one credential. I encourage people to do both because it makes a difference, and especially with the changes that we're having in our state as far as credentialing goes. Dual licensure is very important. It will allow me in my career to treat other than just one diagnosis. I had an LCAS and I was only able to treat clients with SUD. I returned back to school and received an LPC, and now I'm practicing with both credentials.
I'm an ACT team lead, which is assertive community treatment. We treat individuals that have psychotic disorders, and a lot of the people that we treat also have a co-occurring substance use disorder. And on the team, we have specialists that help with different areas of people's life. We also have mental health specialists and a co-occurring disorder specialist. The mental health specialists provide therapy, and the co-occurring disorder specialists provide therapy through the lens of IDDT, which is Integrated Dual Diagnosis Treatment. And they provide harm reduction, they do motivational interviewing, they work with the psychiatrists and the nurses to make recommendations and help clients see what their options are pharmacologically. So we treat individuals with really complex needs, and the mental health aspect of things is just one of those. Whereas the co-occurring disorder specialist also has a background of knowledge that helps treat those patterns of behavior associated with their substance use, and understand that people use substances for a lot of different reasons. One often for my clients is coping with their symptoms. They'll, for instance, drink because that causes the voices to bother them less, or to be social because a lot of them are really isolated. A lot of my clients will use stimulants because the medications make them feel flat, as well as the symptoms, like the negative symptoms of their psychotic disorders. Having this background knowledge is important for us so that we're able to most effectively treat our clients, and they in turn then are able to most successfully live in the communities of their choice.
I would like to work as both a licensed clinical social worker and a licensed clinical addiction specialist. I had the opportunity during my first year internship to work at a community-based mental health and substance use agency. And so I work with individuals who have both a mental health and a substance use disorder. So to be able to treat co-occurring disorders is what I would like to do. So what drew me to this profession was a personal experience with trauma. And so I wanted to be able to take my own personal experience and be able to help others go through and deal with theirs.
There's unlimited options with the MSW degree. Personally, I would like to become dually licensed as a licensed clinical social worker and licensed clinical addiction specialist, and work primarily with adults, and one day own my own private practice. I have family members and friends that have personally suffered from addiction, and I've seen, care that was lacking for them, and that motivated me to get into the field to help others since I couldn't help them. My father is an alcoholic. I would say he's not like a functioning alcoholic. He's never really been able to hold down a job. And then his father, which is my grandfather, he was a functioning alcoholic. So I have 2 generations of it, before me. And just seeing that they haven't really gotten care for it, that motivated me to, like I said, be in the field and help those other people that, since I couldn't help them.
So my mom is my biggest hero. She was evolved a lot in the medical field, and so I started out wanting to be a pediatrician, but I wanted to have a deeper relationship with my clients. And I feel like getting to know people on a personal level, not just seeing the children once a year, is going to help make a bigger impact on their lives. I see a lot of different careers for me. I intend on starting in a psychiatric hospital and doing clinical social work there before moving on to a juvenile detention center, where I plan to work with young Black women, doing a bit of substance misuse counseling, and then going into the Air Force, traveling and helping out with the soldiers there, again doing mental health counseling before opening my own practice.
No one plans to have an addiction, but with specially trained clinicians and comprehensive support, addiction is treatable and recovery attainable. Thank you.